So students, yesterday class I am discussed about the class first post category of the antihypertensive drug, and now going to the discuss the remaining part of the antihypertensive drug. So first one is the beta adrenergic blocker. Beta adrenergic blocker are also used in the treatment of the hypertension. এটা কিভাবে না আমরা দেখেছি বিটা রিসেপ্টর নরমালি two types of the beta 1 beta receptor. One is beta 1 and another one is the beta 2. Okay, and beta 3 also present in the adipose tissue, but that is the present in the beta 3 receptor in the occurs in the very low quantity. So beta 1 and beta 2 normally occurs. So whereas beta 1 is present in the heart and beta 2 is the present normally in the smooth muscle. এবং এই আমরা দেখি যে বিটা অ্যাড্রিনার্জিক ব্লকার্স কিভাবে হাইপারটেনশনে কাজ করে। তো বিটা 1 কি করে, বিটা 1 হার্টে প্রেজেন্ট থাকার জন্য এটা কি করে অ্যাড্রিনার্জিন এবং নর অ্যাড্রিনালিন রিলিজ করে, এবং রিলিজ করে কি করে, দ্যাট ইজ দ্য ইনক্রিজ দ্য হার্ট রেট. Beta 1 receptor is the responsible for the increase the heart rate, and it is the further it is the increase the cardiac output, and also it is the increase the blood pressure. So beta 1 is the responsible for the increase the blood pressure. By the giving beta adrenergic blocker, we can treat the beta hypertension. The example of the beta adrenergic blockers is the propranolol, metoprolol, and atenolol. And among these two, metoprolol and atenolol are the selective antagonists of the beta 1 adrenergic receptor. That is the selective antagonist, beta 1 adrenergic receptor. Whereas propranolol is the non-selective beta 1 and beta 2. Means propranolol drug beta 1 এবং beta 2 দুটো রিসেপ্টরের উপরই অ্যাকশন শো করতে পারে, বাট মেটোপ্রোলোল এন্ড অ্যাটেনোল only শুধুমাত্র beta 1 এর উপর অ্যাকশন, beta 1 রিসেপ্টরে অ্যাকশন শো করে, এবং beta 1 receptor is that situated in the heart, and it is the responsible for the increasing the blood pressure. So by applying antagonist of the beta 1 receptor or by block this portion, we can control the increasing blood pressure situation. Now going to another category, that is the alpha adrenergic blockers. Alpha adrenergic blockers, we know there is a two types of the alpha receptor. One is the alpha 1 and another one is the alpha 2, and both are responsible for the contraction of the blood vessels, or both are responsible for the vasoconstriction. Vasoconstriction, that is the contraction of the blood vessel, and the contraction of the blood vessel is the reason to increase the blood pressure. So by block this process, we can treat the hypertension. So selective and alpha adrenergic blockers are the prazosin and terazosin, and another example is the hentolan. So alpha adrenergic blocker also used for the treatment of the hypertension. Alpha plus beta adrenergic blockers, some drugs available who act both on alpha receptor and also act on the beta receptor, and these drugs are the example is the labetalol and carvedilol. Okay, so these are the regarding the adrenergic and beta adrenergic receptor, how they use as an antihypertensive drug. The details of these drugs already, the physical properties and the Another brand names already covered in the adrenergic system and adrenoblocking system, and that is the another. I cover only the mechanism of action and how it is treat the in the treatment of the hypertension. Okay, so now going to the upcoming classification, and that is the upcoming classification under the antihypertensive drug, and that is the central sympatholytics. Central sympatholytics. The sympatholytics, the term represents that is the action which opposes the sympathetic system, and that is the oppose the action of the noradrenaline and adrenaline. The example of central sympatholytics are clonidine and methyl dopa. That is also known as the alpha methyl dopa. Clonidine and methyl dopa, how it acts for the treatment of the hypertension. Central sympatholytics, that is the that is the in the it is the reduce the blood pressure by acting on the alpha 2 receptor. So central sympatholytics जो drugs की करे alpha 2 receptor ऊपर act करे और alpha 2 receptor ऊपर act करार जन्नो কি হয় decrease the sympathetic outflow, I mean release of the adrenaline and noradrenaline is the decrease, and furthermore decrease the sympathetic action, and sympathetic action decrease means that is the responsible for the resulting, that is the fall in the blood pressure, and that the both drug clonidine and sympatho alpha methyl dopa act, and clonidine is the official as a hydrochloride form, and it is the contain the nucleus of the imidazoline derivative. So clonidine contains the nucleus imidazoline derivative, that is the azole system. Methyl dopa, that is the important in your syllabus, and it is act through the central sympatholytics and for the treatment of the antihypertensive drug. Methyl dopa, the structure of methyl dopa the similar of the dopa, and that is the content methyl on extra methyl group at alpha position. Let's fill the structure, that is content so that is the structure of the alpha methyl dopa. At the alpha position, this is the carboxylic group, and it is the adjacent carbon is the known as alpha group, and alpha carbon, and at the alpha position, that is the 2 number position, it contains the extra methyl group, that is the CH3, and then another or the structure is the similar without this CH3 group, মানে এই CH3 গ্রুপটা বাদ দিলে এটা হচ্ছে ডোপা স্ট্রাকচার হয়ে যাচ্ছে, এবং CH3 গ্রুপ যদি আলফা পজিশনে অ্যাটাচ করি, that is the content, that is the structure of the methyl alpha methyl dopa or methyl dopa, and the nomenclature is that is the 1 2 3, and that is the content. The nomenclature is the 3 at a 3 number position এটা কি করছে 1 2 সরি 1 2 3 4 3 4 ডাইহাইড্রোক্সি phenyl 2 methyl alanine. This is the structure of the alanine. So IUPAC name covered. So alpha methyl dopa, it is available in the form of the hydrochloride form. The brand name of this is the aldomate, m-dopa, midomate. You will তোমরা বই দেখলে ব্র্যান্ড নেমটা পেয়ে যাবে। এটি কালারলেস হোয়াইট টু ইয়েলো whitish odorless fine powder slightly soluble in the water. Water solubility is the slightly soluble practically. So central sympatholytics, it is the act on the alpha 2 receptor and reduce the sympathetic outflow and also the sympathetic action, and thus it is the prevent the action of the sympathomimetics or action of the adrenaline and noradrenaline, and it is the response, and finally it is result in the fall in the blood pressure. The main mechanism of central sympatholytics. The methyl dopa, that is the structure. Methyl dopa, it is the converted enzymatically to the, it is the converted, it is the dopa without methyl group, and it is the converted enzymatically to the noradrenaline, and which is contain a extra methyl group. So methyl noradrenaline convert হয়ে এটা কি করছে, এটা কি করছে centrally on the brain system, and alpha 2 receptor is present on the brain and brain system এ centrally এটা কি করছে sympatholytics action show করছে. So that is the category of the central sympatholytics. Okay, and that is the now going to the ninth category, that is the vasodilators. The examples of the vasodilators are the vasodilators, that is the comes under the ninth category of the antihypertensive drugs. Vasodilator also categorized by two types. One is the arteriolator. It is the this is the vasodilators means relaxation of the blood vessels so that it is the dilated, and dilated হওয়ার ফলে কি হয় যে ব্লাড ফ্লোটা এটা ওর মধ্যে কোনো রেজিস্ট্যান্স কমে যায় এবং ব্লাড ফ্লোটা ইজিলি হতে পারে, and that's why the vasodilators is the used for the treatment of the hypertension, and finally by the blood increasing the blood flow or by reducing the resistance of the blood flow, it is decrease the blood pressure. So arteriolator is the only acts on the artery. The example of this are the hydralazine, minoxidil, diazoxide. These are the vasodilators come under the arteriolator. And artery and venous both on both blood vessels it acts for it. That is the example of the both, that is the sodium nitroglycerate. This act on this vasodilated the both artery and venous. So among the arteriolator, hydralazine is the important on your syllabus, and hydralazine contain the ring structure of the thalazine. Thalazine contain two benzene ring, and one is the one benzene ring, and another benzene ring contain two heterocyclic ring, that is the nitrogen. Two nitrogen present at the adjacent cut at and the adjacent position of the benzene ring. This is the ring of the thalazine, and it is the content at the 3 number position. NH2. So the IUPAC name of that compound is the hydrogen, one hydrogen one hydrogen thalazine. It is the IUPAC name of the hydrogen. So hydrogen, that is the question may be asked the nucleus. Remember the nucleus of the hydrogen and also the whole structure. It is the thalazine derivative and containing hydrogen group at the 1 position. Okay, so it is occurs as a white crystalline powder soluble in the water, slightly soluble in the chloroform. The brand names is the Nepresol, Genopress and Lopress. That is the brand name of the hydrogen. Hydrogen also official as a hydrogen hydrochloride IP, BP, hydrogen hydrochloride injection IP, and other vasodilator sodium nitroprusside. It is the acts on the both artery and venous, whereas that hydrogen acts on the only artery. And sodium nitroprusside, it is that used rapidly for it is used rapidly, and hydrogen is the used for the vasodilator and treat for the hypertension, and it is the used mild to severe treatment of the hypertension. Now going to the further upcoming classification, and that is the number 10 classification and last classification of the antihypertensive drug, and that is the adrenergic neuron blocker. The name suggests that these are the name suggests that these are the drugs which is acts to blocking the adrenergic neuron and depletion of the noradrenaline. So the release noradrenaline রিলিজ হওয়ার পর সেটা অ্যাড্রিনার্জিক নিউরন ব্লকারের দ্বারা যদি নিউরনের ব্লক হয়ে যায়, সেটা স্টোর থাকলে তার যে নরঅ্যাড্রিনালিন অ্যাড্রিনালিন যেটা ডিগ্রেড ইজিলি হয়ে যায় এবং সেটা ডিগ্রেড হয়ে যায়, and by this drug blocking the adrenergic neuron blocker, it is that directly depletes or degrade the neurotransmitter monoamine oxidase monoamines, that is the noradrenaline or adrenaline, noradrenaline, 5-HT, that is known as the serotonin, dopamine. এই সমস্ত monoamines neurotransmitterকে degrade করে দেয় by blocking the adrenergic receptor, and thus this is the the symptomatic section and responsible for the fall in the BP or blood pressure. Okay, so this is the main mechanism action involving adrenergic neuron blocker. The two drugs are available in this category. One is the reserpine. Reserpine is the alkaloid which is obtained from the Rauwolfia apocynaceae family. Normally roots of the, that is the dried roots of the Rauwolfia serpentina, and it is the known as the sarpogandha. Sarpogandha root থেকে dried root থেকে যে অ্যালকোহলটা পাওয়া যায় রেসারপিন, it is the responsible and that it is the responsible for the treatment of the hypertension by blocking the adrenergic neuron. So it occurs as a white or slightly yellow crystal, or occurs as a crystalline powder, practically insoluble in water, freely soluble in the chloroform, and the main mechanism action is that by depletes the monoaminase like serotonin, noradrenaline, dopamine, and it is the produces also the central sedation. By these two mechanism, it is the used in the treatment of the hypertension. And another drug besides the lesser thing, that is the guanethidine. And guanethidine, it is the important. The structure of this drug is the important because it is contain octahydroazosin structure. Octahydroazosin structure. Azosin is the 8-member ring containing nitrogen. So let's see the structure of the guanethidine. So that is the structure of the guanethidine. It is the contain octahydro. Octahydro means the ring containing nitrogen. 8-member ring containing nitrogen is the known as the azosin, and it is just completely saturated. So that's why the that is the octahydro. So this is the octahydroazosin containing the ethyl guanidine residue, that is the ethyl guanidine residue at the on position. So N ethyl, the IUPAC name may be the N ethyl guanidine octahydroazosin. This is the IUPAC name, and it is the form is the monosulfate, official as the monosulfate form, and then monosulfate form freely soluble in water, practically insoluble in alcohol. And brand names is the guaifin, Eporal, and Isobari. Now going to the that is that, and thus this category fully completed the antihypertensive drug. And cardiovascular drugs আমাদের সিলেবাসে আছে, তার অলরেডি আমি কিছু ড্রাগস অলরেডি আমি কভার করে দিয়েছি, লাইক কুইনিডিন অলসো covered in the antiarrhythmic drugs. কুইনিডিন ড্রাগটা অ্যান্টিআররিথমেটিকে কভার হয়ে গেছে, এবং যে সমস্ত ড্রাগ ফ্রম দ্য কার্ডিওভাস্কুলার এজেন্টসে যে সমস্ত ড্রাগ কভার হয়নি ভেরিয়াস ডিজিজে ট্রিটমেন্টে, দ্যাটস আর দ্য ক্লোফিব্রেট, গ্লিসাইল ট্রাইনাইট্রেট, অ্যান্ড ইথাইল নাইট্রাইট. Clofebrate, glycyl trinitrate, and ethyl nitrate. Cardiovascular drugs comes under the cardiovascular drugs. Used to treat various heart disease, heart-related disorders. Clofebrate, it is the hypolipidemic agent or anti-hyperlipidemic agent. So hypolipidemic agents means hypo means lower, lipidemic means the body, the lipids in the body. So এটা কি করছে না, এক্সেসিভ যে লিপিডসটা প্রেজেন্ট হয়ে যাচ্ছে বডিতে, সেই লিপিডের অ্যামাউন্ট, লিপিডটা রিডিউস করছে আর লোয়ার দ্য লিপিড, that is known as the hypolipidemic agents. And this is the hypolipidemic agents is the example of the clofebrate. It is the act to activate the enzyme lipoprotein lipase. Remember the enzyme name lipoprotein lipase. What is the mechanism of the mechanism action of the clofebrate. It is the activate the enzyme lipoprotein lipase. Lipoprotein lipase is the responsible for the degradation of the lipid, especially VLDL. So VLDL, very low density lipoprotein, and this is the degradation by the lipoprotein lipase, and this enzyme is activated. This enzyme is activated by the clofebrate, and thus it is the, and how it is the cardiovascular drugs, and thus আমরা দেখেছি যে কোনো ব্লাড ভেসেলে তোমরা কোনো ব্লাড ভেসেলে যদি করো ডায়াগ্রাম করো, তো নরমাল রেস্টেড কন্ডিশন এন্ড যদি এক্সারসাইজ কন্ডিশন দেখা হয় তাহলে দুটো ফেস হতে পারে। তো দ্যাট ইজ দ্য ব্লাড ভেসেল and that is also the blood vessel. Okay, so blood flow is the normal, that is the blood flow normal because that is the normal blood vessel. Okay, so here is the also in the exercise case the increases of the blood flow increases, but that is the also blood flow that increases. যদি আমরা রেস্ট কন্ডিশনে দেখতে পারি ব্লাড ভেসেলের মধ্যে কিছু লিপোপ্রোটিন বা জমা হয়ে আছে, লিপোপ্রোটিন জমা হয়ে যায়, সেক্ষেত্রে কি হচ্ছে ইন দা এক্সারসাইজ কেস কি হচ্ছে ব্লাড ফ্লো যখন হচ্ছে ব্লাড ফ্লোটা ইনক্রিজ হতে পারছে না, ব্লাড ফ্লো নট ইনক্রিজেস বিকজ ইট ইজ দা ডিপোজিটেড দা lipids and that is known as the atherosclerosis, and this atherosclerosis এর প্রভাবে কি হচ্ছে ব্লাড প্রেসারটা ইনক্রিজ হচ্ছে। তো hypolipidemic agent is the responsible for the reduce the blood pressure by preventing atherosclerosis. This is the main thing, and another going to the these two drug, that is the GTN known as the glyceryl trinitrate and ethyl nitrite. These three drug is the treatment of the angina pectoris along with the cardiovascular drugs or antihypertensive. So this is the treatment, normally treatment for the angina pectoris. Angina pectoris ta ki pain in the angina pectoris position e, left pectoris position e jodi pain সৃষ্টি হয় সেটা কেন হয় inadequate supply of the oxygen, অক্সিজেনের যদি সাপ্লাই কম হয়ে যায় সেক্ষেত্রে তৈরি হয় অ্যাঞ্জাইনা। এবং অ্যাঞ্জাইনা কি হয় আমরা দেখেছি হার্টের ক্ষেত্রে করোনারি আর্টারি যেটা কি করে হার্ট নিজে চালানোর জন্য যে অক্সিজেনটা সংগ্রহ করে সেটা করোনারি আর্টারি থেকে হয়। করোনারি আর্টারি যদি in the case of the atherosclerosis যদি হয় বা লিপিড ডিপোজিশন হয় there is the exercise or some exercise case or কোন কাজ করার ক্ষেত্রে কি হয় যে ব্লাড ফ্লোটা রেটটা ইনক্রিজ হতে যায় বাট ডিউ টু দ্য atherosclerosis এটা ইনক্রিজ হতে পারে না। ওকে, সো কি হয় অক্সিজেনের পরিমাণ যতটা দরকার ব্লাড হার্টে তার কাজটা করার জন্য সে ততটা পরিমাণ অক্সিজেন গ্রহণ করতে পারে না, এন্ড দ্যাট ইজ দ্য রিজন। এবং এর ফলে কি হয় না তোমার সৃষ্টি হয় অ্যাঞ্জিনা পেক্টোরিস বা পেইনের সৃষ্টি হয়। ইটস মেবি occurs like that, so that is the one thing, and this is the treated by the coronary vasodilators. The example of the coronary vasodilators is the like that, example is the glyceryl trinitrate and ethyl nitrite. It is the case another, if you consider the another case like that is the blood vessels and it is the spasms. Spasms means the contraction of the blood vessels, so there is the inner diameter of the blood vessel also decrease, and that is the also decrease the flow rate, and so that it is the unable to supply adequate oxygen to work the any heart, and it is the also responsible for the angina pectoris. So this is the known as the anti-anginal drug. covers in the syllabus, also used in the cardiovascular drug. So assume that is the coronary artery test. Coronary artery test আমরা অ্যাজিউম করেছি এখানে. So glyceryl, let's see the structure of the glyceryl trinitrate and the ethyl nitrite. Ethyl nitrite, that is the CH3CH2NO2. The structure of the ethyl nitride or C2H5NO2. It is the clear colorless liquid. It is the not solid. This is the liquid and liquid volatile liquid, and it is the treatment for the anti-anginal cardiovascular disease. And ethyl nitrite is an important drug as an anti-anginal. That is the structure. This is the ethyl nitrite. That is the glyceryl trinitrate. It is the important drug. That is the nitrate of the glycerol, trinitrate of the glycerol. Like that, this is the CH2NO2, CHONO2, and CH2ONO2. Trinitrate of the glyceryl trinitrate. It is also available as the brand name of the nitroglycerin. This is the used as a treatment of the angina pectoris, used as a decrease the blood pressure, or also used for the antihypertension. Now the physical property is the heavy pale yellow oil, slightly soluble in the water. And let's one more important thing about the glyceryl trinitrate or nitroglycerin. It is the used for prophylaxis of the angina pectoris by the giving root of the sublingual root দেওয়া হয় under the tongue. টাঙের নিচে যে blood vessels concentration of the blood circulation is the more, and so that in the sublingual route যদি আমরা ট্যাবলেট নেওয়া হয়, that is the volatile oil, এবং এর যদি ট্যাবলেটটা হয়, that is the should be stored in the air closed container, and sublingual route নেওয়া হয়, এবং sublingual নেওয়ার পর সঙ্গে সঙ্গে তাৎক্ষণিক রূপে যে অ্যাঞ্জিনা পেক্টোরিসের যে ট্রিটমেন্ট, অ্যাঞ্জিনা পেক্টোরিসের অকারেন্সটা এটা টার্মিনেট করা যায়. Okay, so sublingual route, and another one is tablet may be crushed and spread out the buccal, so it may be taken in the buccal route, but most probably it is taken in the serious condition as a sublingual route. Another isosorbide nitrate, also it is taken, another example which is not covered in the syllabus, taken in the sublingual route. So in this lecture today I covered the antihypertensive drug, the 10 classification of the antihypertensive drug, also describe the details, summarized the mechanism of action, and also আমি যে সমস্ত ড্রাগের ইম্পর্টেন্ট আছে সে সমস্ত ড্রাগের আমি স্ট্রাকচার ডেসক্রাইব করে দিয়েছি, নোমেনক্লেচার এবং ইউজেস অলসো, and also cover the remaining drugs on the cardiovascular drugs, and drugs acting on the cardiovascular, it is the covered in this lecture, in today's lecture. So please যদি কারো কোনো ডাউট থাকে তোমরা ডিসকাশন ক্লাসে জিজ্ঞেস করে নিও. নাও থ্যাংক ইউ.